This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to show you what acupressure is and how you can use it to help heal your dog at home. Hello you guys, welcome back to my channel. For those of you who are new, welcome. In today's video, I'm once again featuring my neighbor's dog. Her name is Pippi. She's been in a few videos so far. She is a great little movie star. She's got such a great temperament. She's super friendly, and she's quite happy to sort of hang out in the house and then also let me sort of demonstrate things with her. She really is a great ideal video dog. She could have a career as a YouTube star. But that being said, in this video, what I'm actually wanting to do is introduce something that I've discussed in the past. It's called acupressure, as another alternate form of healing that you can be using to help heal your dogs at home. So what is acupressure? Well, acupressure comes from TCM, or traditional Chinese medicine. It's very much different in terms of Western conventional medicine. And what you need to think about in terms of the traditional Chinese medicine is their belief is that there's a certain type of energy called this life force energy that is flowing throughout all living beings. And in terms of how they're sort of affecting that and helping us and our animals heal, is the thought is that this energy flows along certain pathways. These are called meridians. There's about 13 different meridians that we can mark out in our dogs. And along with this, and it flows between certain sort of key points. They're called acupressure points or acupuncture points. And the thought is that we can sort of modify those points. We're going to put a little bit of pressure on them. And in doing so, modifying that flow of energy. The belief is that when our pets get sick, our dogs are sick, that natural flow of energy is out of balance. And if we can modify that in terms of putting a moderate amount of pressure on those acupressure points, we can actually normalize that flow of energy and actually help our dogs heal. And it very much comes from the opinion or the belief, really different foundation of medicine, is that we contain our dogs or cats, they contain all they need to actually heal themselves. And we just need to sort of tweak the body, fine tune the body. We don't need a medication that's going to suppress this allergic response, or some medication that's going to just decrease inflammation and treat the symptoms. Ultimately, what it's doing is actually getting at the root cause. I've had some really interesting results using acupressure. I really started as a skeptic. I had no training or exposure at all to any type of Chinese medicine. I had a number of clients that were pretty big into using acupuncture. A number of veterinarians are now trained in acupuncture. But I just couldn't get my head around this whole energy flow, and you put needles into certain acupressure points or you touch certain acupressure points and your dogs heal. It doesn't really conceptually make sense, especially if you come from the conventional background. Yet in terms of seeing it and seeing some of these dogs respond, it pretty much opened my eyes. I think probably my first big experience in practice was actually having a little paralyzed dog in the back of the clinic. He likely had a herniated disc that pretty much caused complete rear limb paralysis. So there he is, he's dragging those rear legs, and we're actually having to manually express his bladder. And the owners couldn't afford anything like surgery, and it's relatively poor prognosis because it had been sort of a few days in terms of being paralyzed. There wasn't any real response. So at the time, I had recently written my book of home remedies for dogs and cats. And I thought, what do we have to lose? Let's try some of this acupressure on this dog, just to see. So I, pressed some of those key acupressure points that are discussed, in particular for paralysis. And I don't know if it was that or it was just a combination of time, but literally 24 hours later, so the next day, this little dog, I think he was a Dachshund cross, some type of Dachshund cross, he was up walking around. Was he 100% normal? No, he wasn't. But he went from being, completely flaccid, where his rear legs were just sort of dragging behind himself, to coming in the next day in the clinic, and there he is, standing up on his rear legs. So that really sort of made me a bit of a believer. And I would love it if all of you guys have that same great experience to sort of, retrain your brain and have you think slightly differently. But at the very least, just be open to the video, and I'm going to show you some of those acupressure points. We've got our great example dog in the back, Pippi, and there's ones that you could go ahead and try on your own dogs right after this video. So we've got here Pippi's left rear leg. I'm holding up this ankle, or this bone I'm hanging onto here. This is also called our hock joint. And just above it, there's a big strong tendon. It's called the Achilles tendon or the gastroc tendon. And so between this Achilles tendon and the bone, the tibia here, is this flap of skin. And this area, this flap of skin, it's called the BL60 point. That's on the outside. On the inside of that flap of skin is called the KI3 point. And so the BL60 is considered the one that's beneficial for arthritis and type of pain or inflammation. The inside one, called the KI3 point, is one that's considered really important. They call it to tonify the chi, in terms of to generally give additional strength to that whole life force energy. So what I would do is, and I'm going to close up, I'll do a close up so you can see it better. I'm putting my thumb on the outside part, just above her hock, good girl Pippi, my forefinger on the inside part. I'm just going to do moderate pressure, holding that for 30 to 60 seconds. And it's something where I suggest you go ahead and do it, 30 to 60 seconds, do it twice a day, do it for a couple weeks, see if it's going to be beneficial to your dog. At the very least, it won't do any harm, may potentially really help her. So here's her hock right here. Here is this big tendon, the Achilles tendon. And so here's the outside flap where my thumb is, and that's right there. So that's on the BL60 point. And the inside of that flap, so right there, the inside of that flap here, this is the KI3 point. So I'm just holding my thumb and forefinger together right there for 30 to 60 seconds. The next 2 points are called the GB29 and the GB30 points. And they're really important ones if we're dealing with a dog that has hip arthritis or hip dysplasia. And so the way to find these 2 particular points, I'll show you Pippi. Let's lie her on the side. So we've got Pippi lying on the side. Here's her left hip right here. And all you're going to do is run your finger along the side of your dog's femur. Go girl Pippi, just stay there. Run along the side of her this big bone in the center of her back leg called the femur. Run along the top, along the bone up to the top, and you'll feel a little point of the bone that's sticking right out. It's called the point of the femur. And where my forefinger is right now, I'll do another close-up on it again too. So the 2 points, it's called the GB29, which is right in here, and the GB30. One's behind and one's in front of the point of that bone. Here's Pippi's knee right here, running my fingers up. So right here, right here is this, on top of the femur is the point of the femur, and there's a depression on either side. And you can sort of move the leg back and forth and feel it. So the GB29 behind, sort of the back, the GB30 in front. I'm using my middle finger, my index finger, my thumb and my forefinger. And I'm just putting moderate pressure on those 2 depressions, holding that for 30 to 60 seconds. The next point I want to show you is called the Bai-Hu point, and it's found in the lumbar sacral junction. So what that means, that's an area, I'll show you Pippi here. Let's turn around. I don't know if you're going to see her better side or not. Go girl Pippi. This is easy to see you this way. So you're just running your fingers along the top of your dog's spine. What you can do is just pick up their tail. And so right there's a little depression where the tail, that's the coccygeal vertebrae, sort of joins the last lumbar vertebrae right along in here. And that depression, we call it the lumbar sacral, is often where the end of the spine, the main part of the spine, the lumbar part, think of your lower back, sort of joins where your pelvis is and then forms into your tail. That's a real common area for a condition called lumbar LS stenosis or lumbar sacral stenosis. So you actually get new bone building up. Pretty common in our middle-aged to older dogs, especially the guys that are big jumpers and super active. My last dog Jesse had it. Would often see it in veterinary practice, especially these real active guys. So there's a depression where the lumbar spine ends, right here, right before the tail starts, that little depression in the bone. And once again, you're just gonna put I've got my middle finger holding it for 30 to 60 seconds. The last point I wanna show you guys is called the GV26 point. And it's one, and it has a couple different indications. One would be if we've got a dog that's seizuring and you're sort of, is there something I can do at home, potentially naturally, that may help bring my dog out of a seizure? That's an option. The other issue you would consider using it for is in CPR. And it's once again, you know, where we potentially got a dog that all of a sudden has stopped breathing. Is there something I can do to potentially stimulate their airway to get them to breathe again? And as an aside, in veterinary practice, if we had animals under anesthesia, often we'd actually pinch that particular area and would stimulate them to actually take a breath. So I'll show you where it is, you get a better sense of what I'm talking about. So here's Pippi's nose right here. So right in here, just below her nostrils, right there. See my index finger is right on it. So in terms of a seizuring dog, you're going to put pressure on that GB26 point. So just below her nostrils, right in that little sort of split of her septum right here. So just kind of hold your finger there, 30 to 60 seconds. And as I said, in veterinary practice, when you have these guys stop breathing, what we'd actually do is sort of grab inside one nostril, pinching the nostril, pinching that center part of their nose. And often that would cause them to take a breath. There's the GB26 point. So there's, I think, 6 pretty easy points for you guys to find. Real good way for you to start with acupressure at home. Thank you for watching this edition of Veterinary Secrets on Acupressure. If you've yet to do so, I encourage you to subscribe. You can do that by just clicking that little circle just above me. And then I want you to go ahead and click that link in the box below. I can send you my free books and videos on how to heal your dogs at home with my top natural remedies.